We are chronically ill as a society. And if we look at the pillars of what's causing that, one branch is the big pharmaceutical industry.
Yes.
Another branch is the food industry. But the other dirty branch is the insurance companies. They are implicitly involved in this. And I'll show you how and why. So the reason I know all this is because I was a drug rep. And then I was a medical device rep, and I stood in surgeries of some of the best and brightest minds in the country. And from there, I owned labs and pharmacies that attempted to bill and work within the insurance framework. So if your grandmother were to come in and try and fill a medication, the average American's on 4 or more prescription drugs, which is just mind-boggling in itself. 4 or more prescription drugs is what the average American's on.
Average American?
Yes.
So like, I'm 55. Would that apply to my age group?
Yeah. 100. This is all age groups. The age demographic, I think 18 to 70-something years old, we're on 4 or more drugs on average, which is mind-boggling. If that doesn't tell you that there's something wrong with us and our system and our food, like, we've got to wake up and realize somebody has to say the emperor wears no clothes. Like, it's terrifying. So I love using the example of metformin because it's a very simplistic number that I can show you. If you come into a pharmacy and you tell me you have United Healthcare, I have a gag clause as a pharmacy owner. It is illegal for me to tell you that I could sell you your metformin for cheaper than what the insurance is charging you. But you paid for that insurance coverage. Why can't I disclose to you that I can give you the product for cash cheaper than your copay? So you come in, I swipe your card. Metformin cost me, I'm going to use ballpark numbers, roughly $2 for a month's supply. I would have sold you the metformin for $4. I'm not allowed to tell you that. I swipe your card, it tells me to charge you $10. That's your copay. So I charge you a $10 copay. Me, the pharmacy, I don't get to keep that money. Who takes that money? The pharmacy benefit manager. They pull that money out to their holding company and they get the additional $7. They short pay me. I don't even get what I would have made if I sold it to you for cash. They're an unnecessary middleman. And when they say they're negotiating down for the behalf of the people, that's just not true. So I'm going to methodically walk you through. What I like to tell people is the margins are made in the mystery. When people say, why is it so confusing? Why can't healthcare be more transparent? How do I not know what I'm going to pay? All of that bullshit is because of these insurance companies. It's because of United, Cigna, Aetna, Blue Cross Blue Shield. It is a system built to monopolize and profiteer off of your sickness. There's more money in you being sick than in you being well. And so most of the insurance companies' profits come from you being on prescription drugs. So they obstruct your ability to get surgery because that's a loss leader. They don't want you getting surgical procedures. They don't get a kickback on that.
Really?
They want you on medicine. There was an article 2 days ago. They're finally talking about how much the big insurance companies were involved in the opioid crisis. Let's look at that. If you look at a product like an opioid, at a compounding pharmacy like mine, we had non-abusive, non-addictive pain creams. We could have prevented the opioid crisis by not prescribing an opioid in the first place. But when the FDA allows opioids to be rammed into the marketplace because the head of the FDA went to go work for Purdue Pharma 18 months later after giving them the goose that laid the golden egg, a label that says these are non-addictive, non-abusive, when they never had a human safety study on that. How can they do that? They daisy chain this drug into the marketplace. It's a lot to digest. So sorry, I'm trying to explain it very complex.
I don't know how I missed the fact that the head of the FDA went to work for Purdue
18
Pharma.
months later, took a big salary job. And it had, I think in the last 40 years, only 2 heads of the FDA haven't gone to work for industry. Then go over to
so Purdue Pharma, to be clear, was basically just OxyContin.
OxyContin, correct.
That was, I mean, they didn't have like an entire...
Correct. And what happened is what happens so often in big pharma. When they say pharmaceutical companies innovate, and that's why they make all this money. Okay, the United States pays for makes up 60% of the pharmaceuticals industry's profitability. But we're ranked 40th overall in healthcare outcomes. 40th. We have a train wreck healthcare system. Again, 4 or more drugs the average American's on. The pharmaceutical companies are not fitting the bill for the research and development. We, the taxpayers, are, because we fund the NIH, and the NIH does most of the early product development. Then they sell the patent to the pharmaceutical companies for pennies on the dollar. Pharmaceutical companies pick them up and use their relationship and lobbying power with the FDA to bring these products to market. Okay, so there's that. The other thing the pharmaceutical companies do that is not innovative and in a way to extend their revenue streams and maximize profits, they refile patents by changing subtleties of molecules or delivery mechanisms, and they get additional patents that make it impossible for a competitor to come into the marketplace. That's exactly what happened with Purdue Pharma. Purdue Pharma's delivery mechanism, the cotton system, was going to expire. They were making millions, hundreds and hundreds of millions. They panic. They say, what do? They scramble to find a different opioid that they could plug into the delivery mechanism. They found Oxy. But the problem with Oxy is it is 8 times more addictive than hydrocodone. They knew this. They knew it. They knew it 100%. And they put it in the drug and they put it into the marketplace. And they met with the head of the FDA in a private hotel for weeks in advance. And they pushed it into the market, and the FDA gave them the golden goose. They put that this was less likely to be addictive or abused than other opioids, which was a bold-faced lie. And then that individual went to go work for Purdue Pharma 18 months later when they left the FDA.
That's shocking.
Yeah.
Shocking. Again, Purdue Pharma didn't make, lots of famous cancer drugs or antibiotics.
No.
It basically just made opioids.
Yeah. Before that, they created the Valium crisis of the 60s, where they were advertising to women in the New York Post and New York Times saying, feeling stressed, pop a Valium.
Yes.
And women got addicted to Valium all over the country.
Drug. Yeah.
So Purdue Pharma has done this multiple times. And the final ramifications are so much more staggering because, again, who pays this? The taxpayers. The real cost of all of this, and this is what I said to the Senate, we can ramble off numbers and dollars. Like I can tell you how the number one reason for bankruptcy in America is healthcare cost. I can tell you how the number one budgetary concern for the federal government is our rising healthcare cost. And I could tell you how for employers, one of the biggest burdens is the insurance plans and covering their employees' healthcare costs. But the real costs are paid in human lives. People like my brother, who got addicted to opioids and lost his life because the system chewed him up and spit him out and let him down.
How did he get addicted to opioids?
He had an ACL surgery in high school, like so many kids, and the insurance companies are incentivized to prescribe opioids. That's the article that came out the other day, and that's what I'm trying to explain about the danger of these middlemen called the pharmacy benefit managers. They're not middlemen at all. They're profit centers for the big insurance companies. And so even on opioids, you could have been prescribed a non-addictive, non-abusive pain cream after your surgery. It would have it's a topical that uses non-abusive, non-addictive ketamine, but in a topical form. You can't consume it, you can't eat it, you don't get high. There's no physiological high from it, but it works. It's very efficacious. Why would the insurance companies not prescribe that over a highly addictive, side effect riddled opioid? The answer is the insurance companies were getting rebates on these opioids. If you look this up, you can do the research. They made hundreds and hundreds of millions of dollars right beside Purdue Pharma, but they floated through
So
all
how
of
did
it
the rebate
unscathed.
work exactly?
So what happens is we'll go back to like a product. Well, here's another hot topic. Insulin will be a great example. Insulin's been out 40 years. Why is insulin 6 times more expensive than it was when it launched? The pharmaceutical companies are not making more than they did when they launched it. Eli Lilly's actually making less per vial than it ever made on insulin. Where is all that extra money going? That money is going to the pharmacy benefit manager. So United Healthcare owns Optum. Optum is a pharmacy benefit manager that negotiates rebates or kickbacks with the pharmaceutical companies. So when it came to opioids, they go to Purdue Pharma and they say, okay, Purdue, I'm just going to use simple math for my small brain. If it's $100 a month, they say, Purdue, we're going to, if Purdue wants to charge 50, they'll say charge 100 and give us a $50 rebate. Okay. And so then United will show you, the patient, that your opioid cost them $100 that month, or whatever the prescription drug is. Prescription drug A cost them $100. They never paid the $100 because they got a $50 rebate. So they paid $50. What people don't realize is 80% of your health plan in America, 80% of Americans' health plan is covered by their employer. most people are getting their health plan through their employer. So at the end of the year, these big insurance companies meet with your employer and say, Bobby Sue was on this opioid all year long. It cost us $100 a month. That's $1,200 a year. We've got to raise your copays, your deductibles, and your out-of-pocket expenses because it's really running up our costs. But in reality, they never paid that. Then where this gets more sick and twisted is a lot of people don't understand this. Medicare and Medicaid after Obamacare has all been outsourced to the big insurance companies. So 60% of United's healthcare's profits are coming from Medicare and Medicaid. And how do they negotiate the Medicare and Medicaid prices?